I remember when I first heard of the Imperial College in London and their epidemiological models that said, if I can translate into plain English, we're all going to die from COVID-19. If anything is called the Imperial College, it's got to be, well, authoritative. That's what the word imperial and college both mean. That Imperial College model was later found to be junk science, cobbled together, and the man who put it together himself admits it was flawed, and yet that was replicated around the world, including here in Canada. Justin Trudeau and Theresa Tam predicted between 50,000 and 350,000 dead under those same models. Of course, the real number is about 9,000, and most of those are in Quebec with their pro-euthanasia, do not resuscitate laws in seniors' homes. But how about Saskatchewan? Not a lot of international travel to Saskatchewan, so perhaps it wouldn't have as many communicable patients bringing the virus in. No direct flights from China, for example, or Italy, two places that had the disease, or Iran. Well, those same models predicted that Saskatchewan, a province of slightly more than 1 million people, would still have between 3,000 and 8,300 deaths, even with lockdowns, 10,000 without lockdowns. Well, what's the actual statistic? 24 deaths in Saskatchewan. A single death is something to lament, but we're all going to die one day. The average age of the deceased from this virus in Canada is in the mid-80s, higher, in fact, than life expectancy. And I come to my point this way. If Saskatchewan, one of the safest places in the country by any measure, especially by this virus measure, is bringing in lockdown laws that persist to this day based on flawed methodology, flawed models, and junk science, can it be legally justified? Especially if it's taking away your basic rights, your freedom to associate, your freedom to assemble, as they say. Well, our friends at the Justice Center for Constitutional Freedom have done a legal analysis on this question for the friendly province of Saskatchewan, and one of their crack lawyers who attended school at the University of Saskatchewan College of Law, Marty Moore, joins us now via Skype. Marty, great to see you again.
With you, Ezra.
I got a question for you. Saskatchewan's been one of the provinces in Canada touched most lightly by this virus. And look, of course, even a single death is a tragedy. But the pandemic that was supposed to kill up to 10,000 Saskatchewan people, it's killed 24. So why is the place still under lockdown?
That's an excellent question, Ezra, and that's the question that the Justice Center is asking as well. And you touched on it rightly when you said, can the government justify these lockdown measures, not only the initially imposed lockdown measures, but the continually imposed lockdown measures that are going on to this day, including in areas of Saskatchewan where they haven't seen a single case, and there's no current cases, not deaths, no current cases whatsoever. They're still under lockdown restrictions. And as you note, governments in Canada are required to justify these actions when they restrict Canadians' charter freedoms. And it's quite shocking to think that a government in Saskatchewan is continuing to maintain, in many cases, very invasive measures, restricting people's freedoms under a perceived and asserted, risk to health and safety, which, quite frankly, can't be justified in the circumstances that Saskatchewan is looking at.
Yeah. You know, early in this pandemic, we went through some of Canada's emergency powers laws with Sam Goldstein, a bencher here in the Law Society of Ontario. We went through the federal laws. And what was interesting to me is they were all time limited. You know, an emergency by nature is not a permanent situation. The idea of a permanent revolution, a permanent emergency, that's the kind of language that communist revolutionaries use to excuse their heavy-handedness. All of our emergency laws have a time limit, have fail-safes in them. And you can understand a pandemic comes in, the death toll starts rising, people don't understand it, people freak out. They say, okay, for a short period of time, 15 days to flatten the curve, 2 weeks to flatten the curve, they said. We're past 6 months to flatten the curve now, and we've learned a lot more. We've learned that the models were wrong. We've learned that young people just don't get sick, or if they get sick, it's very gentle. We've learned a lot more. But the underlying models have not been updated, have they?
No, in fact, in Saskatchewan, as you pointed out, the lowest projected death total in Saskatchewan was going to be 3,075. And, Saskatchewan government, after a month or so, recognized that that was wildly off. So they revised that projection. They said with lockdown measures, our new estimation is 3,050. And to date, there's been 24 deaths. But, the tragedy here, Ezra, is that when the government's gone on this lockdown, imposition on many Saskatchewan residents, in line with, almost every other jurisdiction in the world, there have been harm to the residents, not from COVID in most cases, but from the lockdown measures themselves. And as we note in our report, the tragic case of Aaron Ogden, who, in a knee-jerk reaction, Saskatchewan government canceled surgeries and medical diagnostic exams. Aaron Ogden's life could have been saved. He had a diagnostic exam scheduled for June. It was canceled. On August 15th, he died due to a blood clot that would have been detected in that medical exam that was canceled. This is a measurable life that was lost due to a government decision based out of fear of overwhelming the healthcare system instead of actual scientific evidence as what was actually happening on the ground.
Yeah.
And these are the tragedies that, unfortunately, these stories are going to continue to come out. And this is why in Canada, governments must be held to account to justify measures that violate Saskatchewan residents' charter rights and freedoms. And that includes their charter right to associate. That includes their right to go and receive the services that are necessary for their health and security of the person.
Yeah.
And, to see these measures continuing in this environment with what we know now, as you pointed out, Saskatchewan residents deserve an answer. The charter requires that the government have a pressing and substantial objective that would justify any limitation on charter rights. And at this point, one might ask, what is the government's objective in continuing these lockdown measures?
That's an excerpt from my daily show, the Ezra Levant Show. Every day I do a monologue on the news of the day, then I interview an interesting guest, and then I read my hate mail. You gotta subscribe. Go to rebelnews.com.